Namaste, I am JVN Dr. Priyanka BAIRWA from Faculty of Physiotherapy and Diagnostics. Today I am teaching you a topic which is physiotherapy and its history. So let's start. Firstly, we will discuss about introduction of physiotherapy. Physiotherapy, which is commonly called physical therapy in other countries, is a branch of science that primarily deals with the physical medicine and physical rehabilitation. The process involves the use of mechanical movement and the force to remediate impairments and help promote function, mobility, quality of life. This is complete through the use of careful assessment, evaluation, diagnosis, prognosis, and physical interventions. The work is done by the physiotherapist or physical therapist. The practice is generally undertaken in the local physiotherapy clinics, medical centers, and the hospitals. The physiotherapy profession encompasses activities and the programs including consultation, research, education, and administration. Physiotherapy services may be performed and conducted alongside or together with the other relevant medical services. With their degree-based healthcare profession, physiotherapists use their skill and knowledge to improve a wide range of conditions associated with various parts of the body, including neuromusculoskeletal system, sports injuries, back pain, neurological symptoms, multiple sclerosis, stroke, respiratory symptoms, chronic obstructive pulmonary disease, asthma, cardiovascular system, rehabilitation after heart attack, chronic heart disease, and many more. Now, we will discuss about the history of physiotherapy. So, the science of physical therapy or physiotherapy is believed to have been practiced as early as 4400 BC by the Hippocrates and Gallic physicians as they advocate manual therapy techniques, massage, hydrotherapy methods in treating their patients. In 18th century, the following development of orthopedics and gymnastication was developed to help treat gout and similar conditions through the systemic exercises of the joints, which was similar to other physiotherapy developments. As a professional system, physiotherapy has its earliest documentation origin that date back to the physical manipulation and exercises in 1813 as advocated by the, the father of Swedish gymnastics, Per Henry Ling, the Royal Central Institution of Gymnastics founder. In the Swedish, the term is gymnast is used to refer the physiotherapist or someone involved in the treating those who are ill in the gymnastics. Sweden's National Board of Health and Welfare gave physical therapists official recognition in the 1887, which triggered other countries to follow suit. The Chartered Society of the Physiotherapy was then organized by four nurses in the Great Britain in 1894. In 1913, the School of Physiotherapy was opened at the University of Otago in New Zealand and the Reed College in the Portland and Otago. Has Reconstruction Aid graduated in 1914, which is inception of the science of the physical therapy. The concept of spinal manipulative therapy then became a more major element of the practice. It was towards the end of 19th century when the modern physical therapy was established. The growing popularity of the physical therapy and the relevant events that, that made a global impact call for immediate developments in this industry. Women were slowly being hired for the physical education and the application of the re-medical exercise. Following American orthopedic surgeon getting an overwhelming number of the cases with a disability that needed the treatment. These physical therapy treatments were promoted and applied during the outbreak of the polio in 1916. Physiotherapy was institutionalized during the First World War, and women were recruited to help work with the soldiers, providing physical therapy to help treat the injuries that they suffered from. In 1918, Reconstruction aid then became the official term to refer to individuals practicing physical therapy, with research serving as a catalyst for the physical therapy movements. And with the outbreak of the World War I, the first school of physiotherapy was built at the Walter Reed Army Academy in Washington, D.C. In 1921, the American Physiotherapy Association, originally called Physiotherapy Association or Physical Therapy Association, was organized by Mary Macmillan the first, the same year that the PT review, the first physiotherapy research was published. Physical therapy was then pushed as a treatment for the polio by the Georgia Bomb Springs Foundation in the 1924. The treatment involves massage, exercises, traction. In the early 1950s, the British Commonwealth countries promote the uses of the manipulative procedures to the spine and the extremity joints. Simultaneously, with the development of the polio vaccine was the popularity by the physical therapists rising across Europe and North America. Physiotherapists began the work outside the hospital premises in the late 1950s when they work in the outpatient orthopedic clinics, local physiotherapy clinics, rehabilitation centers, medical centers, public schools, colleges, universities, health centers, among others. It was It was not until 1974 when the specialization for the physiotherapy began in the United States. And the orthopedic section was under the APTA, likewise organized by the physiotherapists to undergo specialization in orthopedics. The International Federation of the Orthopedic Manipulative Physical Therapists was likewise formed in the same year and has since they played a major role in the global development of the field of physiotherapy. Thank you. Namaste. This video is powered by digital version of 2.0. खुश रहो बेटी.